Hi, and welcome, you guys. I'm Taylor.
And I'm Maddie, and I don't know how to work this microphone.
You know what? I feel like it is just this arm that is just the technology. I really went with like high end.
You did.
So I'm very impressed by these mics, but they are finicky. There was one time I had it and it just like shot straight up because you have to like tighten these things.
Well, it's better than just like simply touching it and it turning off, which we could not figure out when we were filming last week. It just like went red and we were like, it's broken.
It's red. Red means no.
Red is bad. And then we just touched it and it turned green.
Trial and error, babies. Mm-hmm. That's what we're here for. Mm-hmm. And speaking of trial and error, Maddie, you got a new light for us. We look bright and we look here. And Maddie is making sure she's in camera view now because last time she was behind the mic.
It was like completely hidden.
You know, it's okay.
Yeah.
We're figuring it out as we go.
We're learning.
I'm just excited to be back on the green couch with you in our new shirts.
That I misspelled.
Because that's unhinged of us. Mm-hmm. And welcome to Unhinged Podcast, by the way.
Right.
Therapist today, unhinged, but
one therapist here that's unhinged.
That's how she spelled it. So she just left out the S because she wanted us to be singular in the shirts. But together here on this show, we are united. So we are therapists.
Yeah. Therapists unhinged. Yes. And today we're feeling especially unhinged.
You know, it's just a work day. You know, you got to come out of work and roll with the punches sometimes.
Right. And now we get to be in a space where all the quiet thoughts we have in our head
are coming out here.
Are coming out for you guys to hear.
So maybe it's like a good thing we didn't record on a weekend because they get the actually raw and unfiltered and unhinged versions of us.
Yeah. Ooh. We'll see what you guys think about this one.
It is an unhinged topic. It's a very not controversial, but I would say a topic that is important. So as much as we will joke around, this is a good topic to go over and just really prominent in kind of society as we start to focus more on mental health. We're just going to bring awareness to overdiagnosing, overpathologizing, and how we can just be aware of ourselves as clinicians, as people exploring mental health, and as people getting on their journeys with it.
And as people who have emotions, this one's for you, which I think we all do. So.
I was about to say, I was like, me?
Us. Yeah. So if you have emotions, this is the podcast for you.
Welcome. And if you don't have emotions, you just turn them off. And that might be just a symptom of a diagnosis. I'm not going to overdiagnose that.
I love that.
That was basically what overpathologizing and what we're covering today.
Wait, I want to give a little example for all the listeners. Okay, Taylor, would you mind giving me your best cough? Oh, that was good. Taylor, I think you have pneumonia.
Oh no.
Right? So what did I do wrong there?
I felt like it was just a jump to conclusion because I cough all the time. I choke on popcorn kernels.
Doesn't mean you have pneumonia.
Does not mean I have pneumonia. It just means I probably should chew better.
Right. And it might mean that I should not be a doctor, perhaps.
I think it just should be a curious doctor instead of maybe, I don't want to say lazy because that would be harsh.
Maybe a jump to conclusions.
Doctor, yeah.
Right. Maybe I need a little more context.
Yes.
Maybe I need to know the level of impairment this cough has on your life.
Dive a little deeper.
Get a little curious.
Yes, exactly. And even as a therapist, we can definitely be like, oh, you're sad right now? You know, that you're probably depressed.
Yeah. You can't focus?
Oh.
You have ADHD.
Speaking to my soul right now, the ADHD wave of the early 2000s.
And let us be clear here. Diagnosis versus symptom, all those things, it does not invalidate your pain or your experience, whether you have a diagnosis or not. We are not here to preach anti-diagnosing, but we are here to preach anti-overuse.
Yes, exactly. And I think as therapists, obviously we speak on what we know, and what we see the most often is the medicalization of emotions. And some of these things are just normal human experiences.
Right.
Like I talked on sadness before. Diving deeper as a therapist, I could explore maybe we had a loss in the family that led to elongated grief. And grief, if gone unchecked for a certain amount of time, does lead to depression.
Right.
But if we move through grief effectively, if we know how to move through our emotions effectively, usually these diagnoses don't necessarily always come up or,
Right.
along
Right.
the way. But I think to that point is it has a way of minimizing at the same time people who do have these diagnoses when we over pathologize and we over diagnose.
So true. And how does it do that? Why does it do that? I think because it takes away from their experience, number one.
Yep.
And number two, then every time this person who's actually experiencing depression, anxiety has an emotion, right? We're instantly just gonna throw that label on it and
Ooh,
yeah.
labels.
label. We're instantly gonna that's just
Labeling is, I think, just a topic in itself of, obviously having a label on you is a big deal.
right.
Having a diagnosis is a big deal. But if done wrong and not curious enough by a clinician or not curious enough by the patient themselves, we'll dive into people self-diagnosing. But it goes to the point of you're changing the way you're approaching life when you have these labels or you have these diagnoses. And that's not something to be taken lightly.
Right.
And I think also to that, like labels hold weight, hold value, hold scrutiny sometimes. And that's like, I wish it didn't, but
Right.
I think if we're talking not just medical, but labeling someone, you think negative.
Yeah.
You know?
Yeah, there's a connotation to it sometimes. And, I think we talk a lot about stigma, right, as mental health professionals.
Yes. And I'd like to think that we're doing really well of moving away from stigma in mental health, but it's still there.
Well, and I'd actually like to add that absolutely we are, but we're almost running way too far in the opposite direction.
Actually, that's going to lead us into this next kind of point of kind of what we're seeing on social media. And I would say like the trends on that is we're seeing obviously people more self-diagnosing, but at the same time resonating with a 15-second clip about having anxiety
Right.
and then leaving it at that.
Right.
And not going past that and not exploring it more with a therapist.
Right. Or even like, those BuzzFeed quizzes you can take.
Oh my gosh.
Right? Like take this 5-minute BuzzFeed quiz and we'll tell you that you're depressed. Right. And it's like, okay, maybe you are, but please, can we have a little bit more follow up there?
Yeah.
More curiosity.
I think those same questionnaires told me I was the Disney princess Belle. So I think those things should not be in the same.
That's pretty valid.
Thank you.
Pretty valid. I would trust it to diagnose me with a mental health disorder then too.
I think, have you ever seen those 15-second clips on social media about the diagnosis
Did you
of
see
the
the
Disney
ones
princess? I'm basically in love with my captor.
Oh my gosh. I was
If
like,
I'm
where are we
Belle.
going? I was going to say, did you see the clips I sent you?
I always see the clips you sent me, but which one?
The ones where I was like, this is why I get spicy on this topic.
Oh, yes.
There were
I'm,
2.
I'm waiting for it. I feel like the spice is coming.
It is. And there were 2. And like, no offense or like judgment towards the people that make these. I just want people to hear and understand that can be taken in many different avenues, right? Like we can, one person's experience saying like, hey, if you have, if you're struggling to get out of bed, if you're sad and you feel like you can't concentrate at work, I'm depressed. Maybe you are too.
Oh, yeah. And there's the things about human connection, which I'm also hearing too from what you're saying. Like obviously connecting with people is powerful, but there is such thing as we see in work transference of just being like putting your stuff on them.
Right.
And that could be powerful too if that person trusts you enough. If that person is like, this person gives me the advice and I make my decisions based on that. That is, that's a watch what you're telling people because it's not fair to them.
That is such a good point. And
Thank
I'm
you.
like clapping silently because clapping for that point because influence, right? The word influencer.
That's why social media,
Yeah, it's so important because so many people are influenced by social media and influencers.
Me, I'm one.
Right? Yes. I mean, we started a podcast. We were influenced to start a podcast.
Shout out to all the podcasters out there.
Yeah, this shit is hard, man.
It's no joke, but I think you texted me today, like that I feel the same way. Like coming on this couch is it's the anxiety behind pressing play because this is so important, and the nervousness and just everything. But every time we do it and every time I'm sitting here with you, it kind of oozes away.
Goes away.
Yeah.
And so what you just described were some really normal symptoms of doing something new and unfamiliar.
Yes.
Right?
Yeah. That
Right.
doesn't mean I have generalized anxiety disorder.
Yeah. And she could, right? You could have it, right? But I don't think we'd be able to tell based off of this interaction of doing something like a podcast, which is new and unfamiliar to us. And we're going to have the normal experience and human emotion of like, ooh, that's a little scary.
Yeah. It's a little nerve-wracking, a little anxious driving. It happens. And those are, like I said, that anxiousness is like always like that fight or flight. What's in front of me? What's going on? Do I have anything to worry about? Am I excited? Because that could be like a symptom of that anxiousness.
Absolutely.
So I just kind of checking it out and see what's going on.
Right.
But you bring a lot of solace to me, so thank you.
Yeah, you to me too. And she fed me.
I always feed it. You can't come to my house and not eat. Ask my sisters. They always get fed.
Yeah, I got some shrimp and steak kebabs and broccoli and sparkling water and a glass of wine waiting for me when I came here. Ooh, that was the sparkling water. But kind of taking it back to, I think I gave the emphasis of the whole influencing thing without following through with that point. But
we're good on it. Go
right.
For it.
Influencing. We just got to be careful. And I do think, I want to say that the influencers and the people on social media that are advocating for mental health and that are talking about it, I love that. I just think if it goes unchecked, it could be harmful.
Yeah.
Right. If we go unchecked, things can start to happen. Like, say, I'll use Taylor, for example, right? This is a hypothetical
That's
thing.
me.
There's not too many people in this room that I can use as an example.
Sorry.
So I'm going to use Taylor. But say she comes to me and tells me that she, lost somebody very dear to her, right? Which you've shared a little bit that you have lost somebody. And you're telling me that you're feeling a lot of sadness. And I say, you've got major depressive disorder.
Yeah.
How would that, I feel like that would be, how do you feel if I were to say oh, you're depressed?
Well, I think with me, I'll take my therapist hat off.
Yes.
I would have been like, that's a lot. That's a little much.
That's a reach.
That's a reach. But I think too, like your point at the same time, like going through this, it would influence me a lot because I think in that moment of that grief, you don't necessarily have that clarity. So you are looking for kind of answers. And I will say, I think in that time, like this is me going back to that of like, I think I was trying to figure out kind of the fix it, you go to that. So if someone is telling me and someone I trust as like a clinician, I would be like, okay, like what do I need to do? Like I would go on that healing journey. I would go down that path because I entrusted someone in front of me that influenced me.
Right.
Because when we're at like our lows, we are vulnerable. And I think when we're in those certain spaces, we're vulnerable. I think there's a lot of things that can make us vulnerable, not just like depression or extreme grief, but I think also just, disabilities in general, they can make us vulnerable. So we lean into those things. So.
And then I'm like doing you such a disservice because what's going on is, like you said,
you don't make it about me losing a parent. You make it about the diagnosis.
Right. I'm not looking at what could be really helpful to this person is to do some like grief work.
Yeah.
To experience the 6 stages of grief, right? Yeah. To really walk through that pain. I need to walk through that pain with her. Instead, what I'm doing is saying, you're depressed. Here's a referral to a psychiatrist. Good luck.
Yeah.
Right?
Yeah. And grief in itself, that's like a whole other topic too, because I think grief is kind of lifelong in its own way, like you dealing with like the loss of someone. So I do think a lot of the times it can be disguised.
For sure.
But it isn't like at that case, like people can move through grief very effectively if taken care of properly.
Right.
So yeah, to that point, I think, that would be the approach is I would need to work on this. Like would need to reflect on that loss. I would need to realize that I need to go into I call it the trench, into the trench to come out. You can't just skip over the trench.
And if you got stuck in the trench and we started to look at, we then look at, this could be depression, right? She's not able to get out of bed in the morning. She's missing
Not
work.
functioning.
She's not functioning. And that's where we could kind of intro into how do we diagnose, right? What qualifies for a diagnosis, right? What do we look at to diagnose somebody?
Yeah.
And what we're talking about right now is impairment, right?
If that level of functioning, that impairment, I always like to use like visuals for my patients. So that's why I talked about the trench. Are they in the trench with a shovel digging deeper? And that's where I'm like, we're going the wrong way.
Right.
And that's where usually that MDD like comes, that major depressive disorder is in, because we've been in that hole for over 6 months. We've, And so instead of trying to find a ladder, instead of trying to find a way to kind of move through it, so I think to your point, I think there's just so many levels, and that was just one beautiful example.
Yeah.
So thank you.
And thank you for talking and like being so open and like vulnerable about that, because I know that was tough. And
well, I think we can definitely touch on grief a lot more, because I think that's such a normal human experience that we have, that we will all go through.
Yeah.
All of us. We're all going to end up grieving something, someone, and it's not linear, and it is ongoing, and it'll come in waves, and some will be high and some will be short, and some will be once a year and some will be more. So I think you realizing and recognizing, are we impaired? Are we functioning properly?
Yeah.
Can be the difference between the heightened emotion and the diagnosis.
So the context is so important.
Yes.
Context matters, you guys.
Not the
pneumonia. You have pneumonia. I am now a doctor. But yeah, I kind of feel like maybe we could touch a little bit on maybe some of the insurance language, and not necessarily the language, but I kind of feel like we didn't just start over diagnosing for a reason. Like the DSM started like to get a workout, and we've just overworked it. Yeah. Right. And DSM stands for
Diagnostic Statistics. Oh, here I have it.
Oh, yes.
Here you go. For those. Sorry. Sorry if y'all heard that. Make sure I'm not on red. This is our purple book of love, the Diagnostic and Statistical Manual of Mental Disorders.
Right.
The 5th edition. Is there another edition out? Am I updated?
I think there might be a new one, but I don't know. I think I saw a blue book.
It just shows you how long I went to school.
Right. I had the purple one too.
The DSM-5.
DSM-5, which is constantly updated, constantly looked through and edited, and
stuff taken out. My diagnosis as a child was taken out. ADD was taken out.
Yeah. And now stuff put in.
Oh yeah. All the time.
Right.
And that goes to show the curiosity of the Psychiatric Association. So kudos for continuing that and not just leaving that. Yeah. I'm glad we're not just using Freud's methods.
Right. We're expanding. We're getting curious.
We are, because as humans, we're evolving, we're changing. We have different things like social media. But back to your point of insurance, I think it depends on the level of care that we're in, and just where we kind of hold our standards. Like psychiatric is kind of more medicine driven and like diagnosis driven, I think, in a way. And then when you come to therapy and therapists, it's more like talk therapy, but there is still a level of diagnosis. I know that I hold in my company, in my space, because we work with higher levels of care with intensive outpatient and PHP, partial hospitalization. And with that, I'm always having to put in my notes what these symptoms are, the diagnosis. I have to be kind of verbiage heavy. Right. But I don't need to be with the patient. And I think that's where I'm like, with them, I will, because this is what's going to get them and keep them in here, and just say like, hey, this shows the insurance what's going on. But with patients, I try to be a little bit more like identifying the emotions first. And then if I'm experiencing anxiety or depression, where is that on a scale of 1 to 10, kind of rating it like pain. Yeah. And I'm like, is it present? Is it not? Or is it just worry? Yeah. So I feel like the verbiage I try to hold on, and we'll get to verbiage, but I want to hear your kind of talk on insurances a little bit more too.
Yeah. And I think kind of why I brought it up is it's almost like therapists and like mental health professionals and people who do, or clinicians who do diagnose and work through insurance, we're pressured sometimes to get insurance companies. Oh my God, I hope I can say this stuff. Insurance companies want a diagnosis, right?
Yeah.
Because we want you to get covered by insurance.
Yeah.
And insurance is amazing that people have it and that it allows us to treat and work with people.
Absolutely.
So
It's
not hating on it.
No, it's an asset. It's a need and it's a necessity in this like field, and it helps you get the care that you're needing if you need it. And I think that's it's important. And I'm glad that the medical field, because I don't feel like insurance covered mental health at some point. Like
It didn't.
Yeah, so I feel like I should know when that happened, but it's been happening my whole kind of career. So
Right,
it's
ever evolving.
Yeah.
But for a while, therapists were not covered by insurance, which was horrific. And so now there's this whole new avenue of like accessibility, which we love. But in that comes its own challenges. And one of those challenges being that a lot of insurance companies require a diagnosis in order to get you covered, right?
Yeah.
So maybe a hot take, maybe a spicy, honest moment here, but there is a level, I think, of like you can get carried away with that too quick. Like what you said was so beautiful, because it's like we can know that, we can do that and have that, but we don't have to put that on our patients and our clients and say and speak in the same language that we write our notes in.
Insurance that we speak to patients. Yeah.
Right.
Absolutely.
Because that's where things can get a little bit convoluted and that's where labels that's where I just go get my label maker and slap a label on your face.
Basically you are. And it's, are they ready for that? It's something that you have to kind of know patient by patient, client by client interaction too.
Right.
Because I'll have patients that come in that I'm like, I'm this, and they already have them. I'm like, okay, where are we hearing that?
Right? Like they come in with like 6 diagnoses, a list of medications, and 0 insight or understanding.
And they're like, I have no idea. And I'm like, you went to all these doctors and now you're coming to me and we're still trying to figure some things out. So it's interesting. But I think to circle back to your point, I'm glad that like obviously insurance like took it all on and it's becoming more prevalent. But I also think that workspaces were like, okay, we need this. Like we need to offer this type of insurance. We need to offer mental health support. And, maybe they had different motivations. It could be just to get them back to work. But I mean, we'll talk about societal pressures. But actually, we could go into that if you want to.
Because this is societal pressure, I think, in its own way, right? I think
is.
the pressure of like if we just look at like economically speaking and like finances and how a lot of people would consider or at some point and maybe even still consider mental health a luxury, mental health treatment. Yeah, mental health treatment. Or like
going to
therapy.
a therapist. Yeah.
Right. A luxury. And insurance has made that a little more accessible and we're very grateful to that. But like I said, there can be many things that come into play and problems that come into play when it's unchecked.
Absolutely. And I think to like that point, I think whenever it comes to work, you're realizing that these people are individuals going through their own experience. I know we talked through grief, but like giving a person, a week off or something like during that time and just not honoring that. And I'm glad, obviously, giving them these assets is great. But I think there is this like, I need to get fixed to go back to work mentality. And that's the Western culture that we live in. And sometimes that's where it is searching for that diagnosis, is searching for that, like what's wrong with me so I can fix it, so I can do this and get back to where I need to be. Right. Sometimes it's the space you're in. I cannot tell you how many people I have encountered with work anxiety on my caseload and like just in general, not even just my patients, friends. And I will say like I'm very grateful for like my job because even as stressful as it can be, I don't think I've ever felt burnt out. Like I've always been very in tune with my emotions, very vocal about it. And there's just so many spaces that don't foster that. Yeah. And luckily the mental health world can be one. And I know there's a lot of other good jobs, careers, pathways out there that are obviously great with it. But there is this like get back, head down, grind mentality. And I think that that's just dangerous.
It is so dangerous. And I feel like I have, and I'm sure you have some personal experience in this too. Sorry, I had to burp, so I moved away. But I decided to tell you that. Didn't think you guys wanted to hear that, but I'm drinking a
But
sparkling
if you
water.
did, you're like, that's what
But if you did, then
was.
special kudos to you.
You're getting yours.
Yeah, you're getting some ASMR. What was I saying? Oh, sorry. The personal experience of that. I remember so many times wanting to know what was wrong with me I was like, you know what? I am struggling to wake up in the morning. I can't sleep at night. I'm exhausted. I'm having trouble focusing. There's something wrong with me. Like,
Yep.
you know what? My life is totally manageable and there's just something wrong with me. It turns out my life was not manageable. I'm a mom of 2. I work a full-time job. I have a private practice, and I was drinking over 600 milligrams of caffeine a day.
Oh, wow.
Context, baby. So
there's the context.
So no, there wasn't something wrong with me. I mean, there are a few things, but like that was not an example.
I just resonate with the caffeine intake because I think I was like laying down one night and I was like, my chest is tight. I was like, I'm up and I had a long day. It's like, oh, because I drank a energy drink right before I taught spin class.
Right.
Yeah, I drank an energy drink at 5, taught the spin class, and then was trying to go to bed after all of that. It's like, oh, Taylor,
Not
like,
gonna work.
No.
So without that context, Taylor, I might say you have some insomnia going on right now, right?
Exactly. But no, I was just caffeinated, and usually you should wait 4 hours to even try to go to sleep after a workout. I waited only like 3. So,
Which little sidebar, TM, Taylor / cycle bar. Sidebar, I recently gave up caffeine. I am a month without caffeine.
I'm just like, it's just a proud moment because I'm like, I could never.
Right.
Tell me how you feel.
I could only do that because I met a really badass psychiatrist. You know who you are. Psychiatrist that will probably never listen to this, but a really badass psychiatrist that put me in my place on the caffeine. I mean, he basically told me I was a moron.
I mean, I feel like if you practice what you preach, people are like, oh.
But I needed that.
Yeah.
I needed, because I've been, I think I knew like, oh, this is a lot of caffeine. I think I knew, but I never had somebody.
How many milligrams?
Like over 600.
Oh, wow.
Like it was like 2 cold brews a day, like 2 venti cold brew type things,
Oh, wow.
which is 300 milligrams, from Starbucks. Anyway, shout out Starbucks for having that much caffeine. But yeah, I never had somebody take the time to really like this psychiatrist could have totally just like heard me say, I'm struggling with sleeping. My mood's all over the place. Like, and could have just been like, slap a label.
Oh, yeah.
Here's a prescription. And he said, how much caffeine do you drink? And I was like, what? Why are you asking me this question?
Thank you for asking. Thank you.
And then I was like, nothing much, just about 600 to 800 milligrams a day. And he was like, in what form? And I was like,
in what life?
I know. He's like, what are you drinking that has? And I explained to him and he goes, here's what you're going to do. You're going to quit cold turkey. You're going to get some Advil. You're going to get through it. And you're going to stop drinking caffeine. He said any medication that you're taking that even had a chance of working would not work with that much caffeine because it's too psychoactive, right?
Oh, wow.
Anyway, thank goodness this dude told me that because I could have just gotten some sleeping medicine or
more meds,
more medication,
more diagnosis.
Kept drinking my caffeine, and I wouldn't know the difference.
I mean, I am a very big caffeine drinker, and I probably won't stop. But I know that there is effects to it. Like that's to everything, to like alcohol consumption, to So it's. I think it is being mindful, but we let those things slip from our mind very easily when they become habits, when they become things. That's a whole other habits
and topic.
I'll come back to that another time.
Right. But yeah.
Yeah, I think just to that point is just, I'm glad that someone just brought that awareness because you probably went in there like, what's wrong with me?
Well, and I actually went in there with, I know what's wrong with me because we as therapists are guilty. We are guilty of that shit.
Yes. So even though we're telling you not to self-therapize, we do it too, but
right.
We don't want to be hypocrites.
Right. So it's very easy. We do it too, but I went in there like with an agenda of like, this is what I have. Let me tell you, sir, how to do your job.
Give me the juice.
Give me the medication to fix me.
Yep. The fix it. Yep. The fix it. Get me back on track.
yeah, I need to just like, this is normal that I need this much caffeine to function day to day and to work what I'm working and to be a mom and to do all the things, right? No, it's not. And that was a really great point back to like kind of like Western culture and what we, that fix it and get back to it, push through mentality.
Yep. And sometimes it is these simple things, these simple changes. So I think that's like what the main thing is, being curious about yourself. And I know we went back to kind of the self-therapy and the self-diagnosing that can come from social media, that because we're not getting curious past that, or it can come from just kind of awareness of ourselves, and we know all about ourselves and not going and asking for help, or going in and only divulging a little bit. Because you could have even been like, not a lot. Like you could, because you don't want to talk. Like you're like, that's not important. Let me circle back to, what I'm here for. So yeah, I think that there's a lot of levels to that. Be open and be honest and about everything, because that's going to get you to where you need to be too. Because I know a lot of times, this is sidebar, but I think a lot of the times, sometimes my patients aren't telling me the full story, and I'm like, well, you can only get so far. I'm only having half this picture painted right now, and there's a whole half missing, and I know there's more to it.
So call to action for you listeners and everybody out there and us is like, you never know what's going to be important.
Yep.
It's all important because context matters.
Context. Well, speaking of context, I think too, like just to kind of go, we talked a lot about like diagnosis is a little here, but I will go back. I want to circle back to labeling a little bit, just and like verbiage, because I think we touched on that a little bit too, about how with insurance we can talk a certain way, but with patients, like I would like to start talking a different way too, because verbiage matters. How we say things matter. Verbal cues, nonverbal cues, shows engagement, shows intentionality, but then also can be harsh on yourself, on people you're talking to. So I know that we've talked, I feel like this subject matter I'm leading Maddie up to is her spicy content.
Can't wait.
I'm like getting you there. Triggers. How do you feel about the word trigger, Maddie?
I feel triggered.
There it is. Go for it.
Okay. So that word, guys, I'm going to I want to be professional about this. Somewhat unhinged, but professional.
I'll pull out the unhinged out of her, don't worry.
Right. Okay. So that word, guys, I don't personally like that word.
Yeah.
And it's honestly not a word I like to use in my practice or in the way that I do therapy.
So it's like moist to you.
Ugh. Oh, I hate that word. Oh, yeah. Pretty much. Yeah. When I hear trigger, I'm immediately like, oh, okay. And what I like to tell people about triggers is what's actually happening is that you're just activated. Your emotions are emoting, right? Usually what we can look at a trigger as is a activation of an unhealed wound.
Yeah.
So if, I'm over here and I say like bananas and
banana. Shout out to the minions.
If I'm over here and I say bananas, and Taylor had this horrific experience where she slipped on a banana peel and she never processed that moment in time, she could very well tell me I triggered her.
My ass still hurts.
Right? And I could say, what do you mean? I'm just talking about bananas.
I'm triggered, Maddie.
Right.
What do you think that does to my relationship with Maddie?
Right. And then I'm like, I just said banana. Anyway, I don't know that she had this experience so long ago and tripped on that banana peel. I just said the word banana, but by saying like you triggered me, I'm expecting Taylor to know that, or she's expecting me to know this banana peel incident she had. And again, I am not invalidating anybody who says that word
or slipped on a banana peel.
Or slipped on it. If you had an accident with a banana, I just want to say that's honestly horrible. The reason I laughed was because I envisioned Taylor slipping on a banana.
Was it graceful at all?
No, you just slipped and like fell forward and hit your face.
Oh my, that actually sounds about right. Sidebar, I broke my tooth.
Oh,
falling on my face.
Was it on a
now
banana?
I'm activated.
Oh my gosh.
I was about, she was like, is she going to
she's activated, which I can hear all day long. I'm like, please tell me why and let me learn about it. Right.
Yeah. Well, I think to your point is like me hearing, or you technically, because I was saying you triggered me. It's it feels like attacking, and it feels in a way like you were describing it could be manipulative. It could be this like, so I think there's a level to it too that it reminds me and circles me back to you and I statements, because there's some good you statements. There's some good ways to use trigger.
Absolutely.
But I think there's ways that manipulation, control come into it, where it's like, I'm using this to control your behaviors towards me. Don't you ever effing say banana to me again.
And I'm like, but I love bananas. I eat them all the time.
Yeah.
What if the point is, when we say triggered, we kind of go into this kind of what Taylor was saying, this language. I think there's a few other words that we've talked about, right?
Yeah, like trauma, gaslighting.
That's a big one. Toxic.
Yes.
Right?
Yep.
And we're just kind of like, we're weaponizing these words.
Yes. And they're a part of, obviously, diagnoses and pathologies. Like, so it harms. I think it does more harm than good whenever we weaponize them. I think it's labeling people and labeling things, and instead of trying to figure it out, it's like basically like enabling.
Well, and I'm like making you, if I then say I will never talk about bananas again, I'm basically telling you like, never do that work on that incident, right? Yeah. Like never do anything about that. I'm just going to adjust.
Yeah.
Right. So that I love the enabling that you brought up.
Yep. It enables it. And instead of that person trying to expose themselves to the fear or the anxiety or things that are coming up whenever banana is introduced, they're like, I don't want to deal with this. You shut up. You stop talking about that. And it's not fair. It's not fair to the person that's in a relationship with you. It's not fair to the dynamic that you share. Because I think the best work in a relationship is identifying like, hey, and if you want to use it here's a positive way to use trigger.
Okay.
I'm feeling very triggered right now. I'm not sure what's going on. I feel like I need to understand this a little bit better. Maybe it was just like an emotional response to something you said, that maybe it was involving the banana. I've had like histories with that before, and that make me sad. My ass still hurts from falling, and I haven't been able to sit properly. So it's a lot deeper rooted, and it's bringing up a memory for me. And I'm struggling with that a little bit right now. And what you're doing is you're not putting the issue at hand on the person in front of you.
Right.
You're acknowledging the issue and saying that something happened in this moment. And I think that that's the difference.
Absolutely. And now if what happens after is I am using banana against
I can't believe
Taylor.
We're fucking using banana.
I'm sorry, it's perfect. And you know what? I wanted to keep it safe because I don't want to. Yeah. For real, if you've had a banana trauma, I am so sorry. I'm not trying to make fun of that.
Someone's gonna comment.
They are, and you know what? I just wanted to use something a little more lighthearted.
Yeah.
But if I'm then saying, "Hey Taylor, banana," after she has told me,
that's when we're gonna say boundary setting.
Boundaries. Ooh.
You'll find out later.
Right. Anyways, verbiage, language, this overuse thing, very, very important to talk about.
I think too, like that point, like segueing it, we can come back to trigger if you need to.
I don't like that word. I don't want to come back to it.
You're done.
I'd like to call it emotional activation, please.
You're done with it. Okay. I will say the next one I want to talk about is like gaslighting. I think that's another one. So when we're talking on all of these words, they're words that have been, the meaning behind them has been kind of disrupted. I know we said convoluted before, but yeah, diluted. And so these words are things, and they are issues. They're manipulation tactics. They are activations. They have definitions to them. And I think along the way, they can be used as labels, and they've been being used as labels towards people.
Yeah.
And gaslighting is a manipulation tactic. And I think a lot of people are like, if someone is lying to them, they're like, you're gaslighting me. And I don't think people are curious enough to understand the definition behind some of these things. So I will say with gaslighting, one of my favorite examples of this is someone who lies to you. If you catch them in a lie, they're like, okay, yes, I was lying to you. This couch is not white. It is green, and I lied.
Thank you
The
for
person,
acknowledging that.
yeah, the person who is gaslighting is going to be like, you're crazy. You need to get your eyes checked. You're colorblind. Like you're someone who is trying to just
Put it back
throw
on you.
attacks and put it back on you. And understanding that, because that one's a very extreme to the next of what is going on in that interaction. So
Right.
to that example and to these examples, these words have definitions behind them, and you need to be curious about them, because when you're using them in conversations, they can be harmful.
Absolutely.
So take care of that and stay curious with it. Because when we hear it on social media or we hear it from others using it and just assume, you make an ass out of you and me.
Right.
As your therapist.
Yes. Lovingly stated. I love that. And I love just, I think sometimes it's hard to talk about these things because, at least for me, there's a level of like, I don't want to offend anyone. I don't want to.
The people, please.
Right. Oh, she always comes up. I love her so much.
She's such a good girl.
She just wants to be loved. Yes. And then I think back to the point of like, yeah, I don't want to enable this anymore. Like, I don't want someone to, if I'm doing it, like, if you hear me over here doing some of that stuff and like, I would hope you'd hold me accountable and, tell me what I'm doing that I might not know. But I think that we've kind of established this safety of all being within ourselves, right? And only seeing from a self perspective, right? Yeah. It's putting us all in a box, I feel like, with labels and diagnosing and words where we're boxing people up and we're not letting them out. Yeah. And I think that's the most harmful thing. And the biggest reason we kind of wanted to talk about this is because we've got to stop being so close-minded.
Oh, yeah. The boxing and like, I will talk about like a little bit too. I know we've reflected on like society and just how we try to fit people into society with like diagnosing and, medicating. And sometimes, and I know that maybe some people know the verbiage ableism, but that's what that is. It's saying like, hey, something's wrong with you. You need to fit into this box and this norm and this mold. And sometimes that can be what people do to themselves. And that's so unfair. Yeah. And I think at the same time too, with these diagnoses, people get fixated on them and don't shed them. I like to call it shedding. Yeah, I love because sometimes people do move out of diagnoses that I've seen.
There's plenty.
I think like if you don't if you don't view it as a healing journey, as not this enclosed space or this label that is on you for life, that's just where you lose that translation. You lose that curiosity with yourself, which I think is the most dangerous.
So bad.
Yeah. So I think it's not a box. It's not a label. It is something you are going through if you are. Yeah. And it's real. And that's why we have a friggin' job. Yeah. Like they're real. Right. It's just saying the people who come in and are just looking for that label, that's not how this works. It's the taking that next step. It's wanting to go further, and it's staying in that mindset is the most important thing I think we're trying to put into context today.
And like whether you do or you don't have a diagnosis, or it's a symptom versus just a diagnosis, that does not make it any less like valid or invalid, right? Like your experience is still matters. And you are valid in what you're feeling. We don't need to have a diagnosis or to identify specifically with something for it to matter. And I think a lot of people feel like that is the only way they can be seen. Yeah. Is if they have like, because so many people in life, like, even me, I felt at times where people don't understand my emotions or my, what I'm experiencing. And I have to be like, oh, well, by the way, I'm OCD. Yeah. Right. And so I do think that there's a piece in there of just like, us trying to so desperately be understood. Yeah. And what's happened to me in my experiences, sometimes I lean too heavily on that. Yeah. And then I put myself back in that box. Yeah. So curiosity, being open-minded, and just stepping out of that box that society and we put ourselves into.
We're working really hard to have, I hope, continue as a therapist, to have the world fit us. You don't need to fit the world. And I think you kind of talked on it. And I was like, Maddie, like the world you live in, the world you create with yourself, the relationships you create, they deserve to fit your needs with those diagnoses, those things.
Right.
Because they're a part of who you are as a human. And I think we just use these labels to explain things that don't necessarily always need like super explaining, but
Right.
they do help us have this awareness of ourselves when we don't think the same as others. And it does kind of give us sometimes that aha moment and like, oh, that makes so much sense.
Right.
That feels great. Like I understand myself now, or I understand myself a little better. So now I don't need to be crippled by this. I can help myself heal. I can help myself move through this. I can help myself live properly, live effectively.
Yes.
But
and little like surprise and just kind of like moment to understand like they were also created to help clinicians and doctors treat a group of symptoms, right? So diagnosing is really important.
Oh yeah.
In validating an experience, right? If that's validating to you and helping explain things, and it gives a directive for treatment. So yes, it's important. Yes, we need it. It's also overused, and maybe we could like segue to shift a little bit into how we can like reframe this narrative.
Yeah. I think too, like you were saying on that point, is we've been doing a lot of work of making their awareness. Now it's like, okay, we have this awareness, but let's reel it back into this state of being like these diagnoses are being more prevalently used and we're stating these things. Just stay curious about yourselves. Stay knowing that there's so much work to do on our end, but there is work to do on your end now that you have that awareness. And I think finding that middle ground of not being overly aware, like not being too stay in tune, but not in tune, too in tune where you're giving yourself the whole DSM vibe.
Or intellectualizing the shit out of yourself.
Yeah.
Right.
I mean, yes, exactly. Don't WebMD.
God, don't Google diagnose. Please.
Don't Google diagnose. And if obviously you resonate with something on social media, beautiful.
Amazing.
Don't stop there. I love that people it's like, we don't want to shit on what's happening on social media because I think it helps just keep the conversation going.
Yes.
But I think it's just that we stop there. We don't go see our therapist. We don't make that appointment because that made us feel seen for a second. And that's like, haha, hee, Band-Aid.
Band-Aid.
You just Band-Aided it.
You just put a Band-Aid on it.
Yep. Because what you did is like sometimes you just did a little digging and that was it.
When it got a little too deep there, we're just like, oh,
yep,
never
that
mind.
was a little shoveling of dirt.
Yeah, you're stopping there. And guys, this is important to talk about real quick just because there are so many websites now where you don't even have to see a person face to face to get a medication.
Yeah.
Which is so...
I think I did that for my eyes.
Look, again, I'm not a doctor, will not speak on the medical portion, but I know and I'm not even going to say the companies, I just know they exist out there
with over here massaging my boob. I just realized sorry.
With good intention, right? Maybe. I don't know. We don't have to get into that.
We don't.
Not ready for that. Right, but there you don't even have to see someone face to face now to get medication like for psychiatric things as well. Like there are plenty of places where you can be like, oh, I've had this prescription before. So let me just, yeah. And that is so dangerous.
That's not curious.
That is not, shame on you. I'm just kidding. No shame.
No shame.
Don't you ever feel shame.
But reflect
and think about maybe what we could be doing a little bit differently there.
I agree. And I think to the reframing, oh shit, I had a point. I knew it.
Was it about encouraging language around resilience, growth, and human variability, perhaps?
No, I think it's like, that's kind of been my curious, like, whole standpoint. But I think to that, like, being vulnerable, like I said, those like kind of Band-Aid moments where we just feel like a little seen, a little resonating. Oh, that was my point. You're so much more complex than that. Don't do yourself a disservice, like of saying like, oh, hee.
Love that. I love that she's doing that.
I know. I'm unhinged today.
I love
just
it.
massaging my boob on camera. But no, I think you're more the complex than that. You deserve more insight than that to yourself. And start with those emotions. Start checking in with them. Don't make it a diagnosis. right away. And then if we're saying like, hey, this is emotion's been ongoing, I'm experiencing like these symptoms, I do drink 600 milligrams of caffeine, go talk to someone about it. See like what's going on if you're needing a little bit more insight or in tuneness. Because if you're having like chite test, oh my God. If you're having a tight chest like me right now, that's not necessarily always a sign of anxiety, but it could be. And so go talk to someone and get that clarification.
Yeah, as long as you're staying curious, and you're going further than just the initial like aha moment, right? Like you're not stopping there.
Don't let the light bulb go off.
Don't let it go off and then smash it on the ground and never visit it again, right? And I think like to kind of like wrap this very beautiful conversation up, where we really want to take you guys is when we're talking about not stopping, we want to keep going towards growth, healing, resilience. We want to encourage. That's what we're working towards.
Recognizing the motivation behind it and making sure we're not fixing it to go back to
square one.
Because square one is what got you exactly where you were.
Mm-hmm.
If you think about it.
Right. Yeah. In a lot of cases it is. And then some it's like, there's chemical stuff and imbalances and stuff, and we don't even have to get into all that.
Yeah, we'll get into that another
that's
time.
a whole other episode, right?
I even feel like this one, we might need to circle back to this topic at some point.
It's a good topic.
It is. But I think like touching on it is important. And so this is only episode 2.
Wow. Episode 2. I think something that we wanted to start doing in honor of making things more accessible and like helping you guys learn and find resources.
Yeah, I think we're going to end up posting some on either our YouTube channel, probably more often, I think, because I don't know if I'm allowed isn't the word, but I don't know if I have access to doing that on the podcast streaming on Spotify and Apple Podcasts, but for sure YouTube, because I linked, I think, our websites and stuff like that.
We can do Instagram too, maybe?
Yeah, I did Instagram on our
cool.
first episode.
Cool.
So if you look in the comments on the YouTube channel, which you're technically on if you see me waving, hi.
Hello.
So just scroll to the bottom underneath, you'll see that I'm not necessarily allowing comments on YouTube right now, but maybe I'll open it up. If
I don't know.
Don't read the comments.
Little people pleaser.
I know my people pleaser.
She doesn't want to know.
You know what?
Right.
Just
but
don't read the comments.
Yeah, and I think we'll try to start doing that, and because between the two of us, we've got a boatload of resources, and we want to share that with you guys.
We do. Like we said, mental health is on the rise, and insurances are more accessible, and if you experience workspace stuff and you have access to that insurance that covers us, perfect. We're here for you to help provide those things to see. And I think that's a good place to kind of put it.
I do too.
I know. Oh, I guess we should cover what we're going to be doing next week. You kind of got a little sneak peek earlier when we did our
because we 1, 2, 3
boundaries. That's going to need to be like more than one episode for sure. Maybe we'll make it a 2-parter.
2-parter. Who says that?
A 2-parter.
Who says that?
I can't say.
We're not allowed to say, but you know who you are if you ever hear this, which would be amazing. I don't know how you'd come over to this neck of the woods, but
she's one of our favorite podcasters.
Yes,
but if it ends up being too long, we'll cut it in half and we'll probably release it like in a week, because we usually show bi-weekly, so we could even do that.
Yeah,
that'd be fun.
That would be fun.
Let's do that. It's gonna be saying no is a love language.
It is.
Yep. So y'all got insight to that, and thank y'all for obviously being here and being unhinged as hell with us over such an important topic.
Yeah,
I think that felt good.
It did feel good.
Don't know why my chest is tight, but that could just be my posture.
Or you could have generalized anxiety disorder. Just kidding.
No.
I have no context.
I'm like, have I drinking a lot of caffeine today?
Yeah.
I don't know.
We're being curious. Don't you guys
curious.
worry.
We're asking the questions. Keep asking the questions.
Keep asking your questions, guys.
Stay unhinged. Go look at my flowers. Go buy yourself some flowers.
Go buy yourself some flowers. Go grab a sparkling water and then just pour it all over yourself.
Or blow into the...
Beautiful.
Stunning. Oh, sound bath. Go to a sound bath.
Go to a freaking sound bath.
Go do some yoga. Go just high knee it up.
Or lay on the floor and just stare at the ceiling.
Oh yeah, ceiling flan staring.
Flan staring.
Did I say that? Bye.
Thank you.
Thank you. Come again.